AM 1430 KRGI 105.5 FM. Good morning. I'm Brian Gallagher, a guest in studio from Central District Health Department. The Chief, Teresa Anderson, has come back to check up on us. Hi.
Good morning, Brian. How are you?
Good.
Good.
You've got some new tools to work with, so let's talk about how they potentially can help folks in this area.
You know, we keep getting new opportunities, and this is an opportunity that last fall when the Hall County Community Collaborative, which had been doing a lot of early childhood education, and also helping some folks who are in positions where maybe they can't afford their utilities or they're having trouble making their child care payments, those kinds of things. We had some funding through Nebraska Children for that through the Hall County Community Collaborative, which then had to go on hiatus. So they're not active right now. We took over the programs just to make sure that they would stay alive. And it was a good thing that we did that because it's helpful to the community to know that those funds are still there and we're still applying them to activities that strengthen our ability to care for our children properly when they're in daycare or even at home. One of the new opportunities in that just came about this year is a grant we've received from DHHS, which is money to help. They're called stabilization funds. So what they do is when people find that they're in a pinch, you know, maybe a one-time pinch, maybe they can't make the car payment or the house payment or the babysitter, they're trying to figure out which one's most important. We can sit and talk with them because we have community health workers who are trained to help people identify what do they really need first and how can we get them out of the pickle, so to speak, into a situation where they can meet all the payments. So we have one-time offerings of a couple $100, or if their utilities are being shut off, we can call the utility company and say, hey, we can pay this month's utility bill. So it's really about just meeting people where they are and then trying to lift them up a little bit.
Let's face it, budget discussions lately have been frequent and for just about everybody. So as all of this evolves, it's nice to know that there might be a channel that can provide some temporary aid, but that's where it also becomes a responsibility of that person to say, okay, which one's vital, which one is really, really important, and then you can get that one taken care of for now. Try to work on perhaps maybe some better decisions for the future, because sometimes you have to decide between the want and the need.
Yes.
You gotta pay for the need. The want sometimes has to get pushed to the side.
And sometimes just a communication, a simple conversation will help determine, yeah, I thought I needed that, but it was what I really wanted. This is what we need, and then we can move on.
Talking with Teresa Anderson from Central District Health Department, there is some additional funding available as part of an ongoing effort to try to keep track of kids, make the life better for the future. This is logical, though, for you guys to lend a hand even in the short term because, let's face it, child health care is something that is vital for all of us.
It is. Another opportunity that I will say we inherited is part of a community development block grant through HUD. So we're working with the city with those dollars. There is funding there for child care centers to bring them up to code. They need to have inspections. They need to be, what's the word I want to say? I forgot. They need to be inspected and certified as child care facilities. They have to have a license, sorry. So we can help them with those, maybe their fire detectors, maybe their door jams, maybe their egress basements. We have some money for that. Those funds need to be expended by the end of the year. In addition to that, we also have some child care scholarships available through that community development block grant for people who meet eligibility requirements.
There are a lot of opportunities out there, but sometimes it can be confusing at times. So if they have a question, how do folks find out more?
Right. We just need you to call us and talk to us. We've got any number of people who are being now currently trained to assist. Call 308-385-5175 and ask for anyone who can help with the program, because right now we're shifting leaders, so we've got some changes going on with management. But if you call us or even go to our website and see what we have on there at cdhd.ne.gov, you'll find a number of services available, and we'll We'll assist you. Front desk knows exactly where to send you if you call us.
Step by step, find a way to get it done. Teresa Anderson, always a pleasure. Thanks.
Thanks, Brian.
Good morning from AM 1430 KRGI 105.5 FM.